Welcome. Good afternoon. I'm Jeff Resnick. I'm Chief of the History of Medicine Division here at the National Library of Medicine at the National Institutes of Health. Thank you for joining us for today's National Library of Medicine NLM History Talk. This annual series of programs is designed to promote awareness and use of NLM and related historical collections for research, education, and public service in biomedicine, the social sciences, and the humanities. NLM History Talks also support the commitment of the NLM to recognize the diversity of its collections, which span 10 centuries, encompass a wide range of digital and physical formats, and originate from nearly every part of the globe. Moreover, NLM History Talks foreground the voices of people of color, women, and individuals of a variety of cultural and disciplinary backgrounds who value these collections and use them to advance their research, their teaching, and their learning. So welcome, everyone. And for those of you on Twitter, thank you for following along using the hashtag NLM Hist Talk. And for those of you who wish to share questions with our speaker this afternoon, please use the live feedback button under the video to send those questions to me, which I'll then share with our speaker. So today I have the great pleasure and privilege of introducing Dr. Soa Bayoumi, Senior Lecturer in the History of Medicine, Science, and the Humanities program at Johns Hopkins University in Baltimore. Trained in political theory, political philosophy, and the history of ideas, Dr. Bayoumi works on the question of justice at the intersection of history, political theory, and science, technology, and medicine studies. Growing up in Cairo, surrounded by both medicine and political activism, she later became interested in understanding how medical professionals' political leanings shape their medical practice and how their medical expertise and practice shape, in turn, their political and social choices. Dr. Bayoumi also particularly interested in gender studies and post-colonial studies. After receiving her BA from Cairo University, she went on to complete her graduate studies in France at the Sciences Po in Paris and conducted research in Italy and in Germany. Before teaching at Hopkins, she taught at Harvard's Department of History of Science between 2011 and 2021. With her research located at the intersection of medicine and public health, and focusing on questions of health and social justice, as well as biomedical ethics and the medicine politics nexus, Dr. Bayoumi has published extensively in her field. She is currently finishing a book manuscript for Stanford University Press, co-authored with UC Irvine medical anthropologist Shireen Hamdi on the roles played by doctors in revolutionary and post-revolutionary Egypt. Dr. Bayoumi is also working on another book project on the social roles of doctors in post-colonial Egypt. Complementing her research, her writing and teaching, the history of medicine and public health, the humanities, and gender and sexuality, Dr. Bayoumi is editor of the Journal of Middle East Women's Studies, and she is associate editor of the Journal of Islamic and Muslim Studies. Today, Dr. Bayoumi joins us to discuss the field of graphic medicine, defined as the intersection of the medium of comics and the discourse of healthcare. The title of her talk is COVID Comics, Decentering White Narratives in Graphic Medicine During the COVID-19 Pandemic. Dr. Bayoumi, welcome. Thank you for joining us today. We're very excited to hear your talk. Thank you. Over to you.
Thank you very much, Jeff. I appreciate your very kind and generous introduction and the opportunity by the NLM to participate in the history talks. This is a great moment for me to share this topic that I've lately been interested in. I have been interested in the topic of graphic medicine for many years now, but over the last couple of years with the pandemic, the COVID-19 pandemic, I have been particularly interested in thinking about how the field is changing, the different ways in which the field is changing, and how it is accommodating or not it's becoming accommodating or not to new voices and different voices. So, Jeff, in your introduction, you graciously offered a brief definition of graphic medicine. For those who are not familiar with the field of graphic medicine was defined according to the Graphic Medicine Manifesto published in 2015 as the intersection between the medium of comics and the discourse of healthcare. This is from the introduction to the Graphic Medicine Manifesto published by Penn State University Press in 2015. So what is it about comics that is interesting in general, but particularly interesting to medicine? Why is it that a lot of scholars, artists, and practitioners, healthcare providers have been interested in the potential of comics and the different roles played by comics in a clinical setting, but also in general in sort of understanding the cultures of medicine, if you will? One element that has been highlighted a lot is the notion of abstraction, how comics as a visual format, as a visual art, compared to other visual arts, relies a lot on abstraction. Think compared, for example, to photography and even to painting. My colleague Brian Fees, author of Mom's Cancer, by now one of the essential books, part of the classics, if you will, of the canon of graphic medicine, published in 2006 and winner of the Eisner Award, talked a lot about abstraction. And one aspect that he highlighted to sort of showcase the meanings and the roles played by abstraction in comics is by thinking about Charlie Brown by Charles Schulz. Many of us are familiar with Charlie Brown and the ways in which Charlie Brown's face, Charlie Brown's head, is sort of represented in very simple, almost simplistic ways, right? Using just a few lines, a circle and two half circles for the ears, and just a few lines, some wiggly lines for a frown, for instance. But how Charlie Brown has been able to actually attract us in many ways and even push us to empathize with him, to break our hearts sometimes, or to make us happy, or to make us laugh, just because of the abstraction involved there. The fact that a lot of us can identify with this abstract figure. This is a point that a lot of comic scholars have talked about a lot. Another element is, the cliche that is often used, the idea that a picture is worth 1,000 words. And comics are not just pictures. They are an art form that is based on the combination of text and image. Think, for example, I'm using this page from Katie Green's Lighter Than My Shadow, published in 2013, in which it's a graphic memoir in which she writes about her experience with eating disorders and with other mental health issues. And on one page, you can see her depicting her adult self, her current self, if you will, and her younger self, and thinking about who she is in relation to her younger self. This is something that would take pages and pages of text alone to sort of describe in order to relay this message to the reader. But using the combination of text and images, you can be very concise and very very effective in relaying these messages and conveying them to the reader and viewer. As Melina Jablonski wrote, comics may convey a story in a more flexible, multidimensional way, and due to their visual nature, they are more expressive and engage the reader on a deeper emotional level than the written word alone. Another element that a lot of observers, scholars, and even artists have invoked when it comes to talking about comics and the importance of comics in thinking about medicine, the field of graphic medicine, is the idea of controlling one's narrative. When someone is sick, when someone is dealing with a significant health condition, there is a lot of vulnerability that is often experienced by the person in question. Sometimes people describe it as a loss of control, or even in some cases, a loss of independence. The idea of regaining the ability to control one's narrative, one's story, seems to be empowering to many people who deal with health issues or serious illnesses. These are themes that have infused the field of narrative medicine since its inception. In her 2018 memoir, RX, Rachel Lindsay sort of depicts the idea, this impulse to control one's narrative. In her graphic memoir, RX, Lindsay talks about her experience with bipolar disorder and her hospitalization, which was not a voluntary hospitalization in many ways, and sort of like the different feelings she was having as a result, particularly the loss of control and the loss of independence. One thing that she decided to do, as she talked about the way, how she came to create the book, she talked about accessing her hospital notes, the notes that were taken by her psychiatrist and by her treatment team about her as she was experiencing a manic episode during her hospitalization, and to illustrate those notes using her own way of thinking and remembering that experience, which was in many ways a very difficult and traumatic experience for her. And in talking about this and her choices, the artistic choices she made, she talked about wanting to take control of the narrative at a moment when she felt very vulnerable, at a moment when she felt that she was not in the driver's seat. So this ties into the idea of the cathartic functions of comics. A lot of people talk about comics as a way of processing difficult experiences, and trying to make sense of illnesses that can upend the world as we know it for the person involved and for their loved ones. Think, for example, of Alison Bechdel's Fun Home. Even though Alison Bechdel's Fun Home, which was published in 2006 and turned into a musical, talks about many issues apart from illnesses, but her discussion of mental illness in her family, whether her struggle with OCD growing up or her father's depression and ultimate death by suicide, Fun Home has been considered one of the classics, again, in the field of graphic medicine. And here, it's a way for her to make sense of that very troubled past, as a child growing up, in the funeral home / fun home. In addition to the cathartic functions, there are didactic functions to comics. A lot of people have talked about how comics have been helpful to communicate, for health communication, for medical communication, for facilitating communication between patients and providers, and for raising awareness in general, using comics in the form of pamphlets, for example, for patients to explain certain issues about diseases or to raise awareness about certain risk factors, etc. This is, for instance, from Kathy Leamy's Diabetes is After Your Dick, where she's talking. Kathy Leamy works, among other things, as a medical illustrator and as a cartoonist, and has worked with Mass General Hospital to produce a number of, in Boston, to produce a number of comics for a wider audience and for patients about certain issues, including certain illnesses like diabetes, for example, chronic conditions. And this has been used as as an example of one of the ways in which comic, using sometimes levity or humor, can be an effective way of teaching people about medical issues and health issues. A lot of what we see in the graphic medicine field can be described as visual or graphic pathographies. The term graphic pathography was coined by Michael Green and Kimberly Myers to refer to a subgenre that addresses patients' experiences of illness, basically illness narratives, pathographies in graphic or visual format. And in the Graphic Medicine Manifesto, they describe in graphic pathographies, artists create their own iconography of illness. In doing so, they are creating new knowledge, combining subjective feelings and perceptions with the objective visual representation. As we saw in Katie Green, for example, and Katie Green's Lighter Than My Shadow, we see this idea of, depicting the objective world, as you will, while at the same time, on the same page, depicting inner perceptions and inner worlds, if you will, of the patient or the person in question. This was the idea of creating visual pathographies of, in the Graphic Medicine Manifesto is explained as something that allows patients, that allows people who are living with illnesses to take control of, their narrative again. They write, this was traditionally the domain of the doctor or medical artist who wielded power by controlling and standardizing the way that diseases were visualized. Graphic medicine seeks to disrupt this power imbalance. We believe those best positioned to represent illness and care and caregiving are those living with it. And of course, they're using the term nil de nobis sine nobis, which, is a rallying cry for a long time, was a rallying cry for the disability rights movement. In the 1990s, author and disability rights activist James Charlton applied the term nil de nobis sine nobis, or nothing about us without us, to the disability rights movement, and it became a rallying cry for many in the disabled community, which included not only making sure that the input of disabled people is at the center of laws and policies and guidelines and accommodations that would work best for them, but it's also been a slogan that motivated many to take control of the narrative about their lives and their disabilities or their chronic conditions. In addition to the visual pathographies, the narratives of illness written by people who are living with the illnesses themselves or by their loved ones in some cases. We also find in the field of graphic medicine a lot of narratives written by the providers themselves. For example, the Annals of Internal Medicine has recently, since 2013, basically, they have been publishing a lot of comics by physicians and other healthcare providers. Mike Natter is a physician who who's also an artist and has published with the Annals of Internal Medicine under the title Progress Notes about being a resident and the difficulties, the difficult cases that he encounters, and even the burnout that a healthcare provider or a doctor experiences. Obviously, this has all been exacerbated over the course of the COVID-19 pandemic. Grace Ferris is also another physician who writes for the creates comics for the Annals of Internal Medicine under the rubric Dr. Mom, where she writes a lot about being a mother and being a physician and the demands on her time, the competing demands on her time, and how she uses sort of like the different struggles, but also the different joys of being both a physician and a parent. Ian William has famously written The Bad Doctor and then The Lady Doctor, two books about physicians and their practice in Northern Wales, and in which they're, particularly in The Bad Doctor, we see him, for example, talking about the doctor's struggle with OCD, the doctor's mental struggle in many ways as well. M.K. Serwick is a nurse and an instructor of medical humanities and comics who wrote the story of wrote the book Taking Turns, stories from HIV/AIDS Care Unit 371, which was based on her experience working in the Chicago Masonic Hospital Unit 371, which was dedicated to HIV/AIDS patients in the 1990s at the height of the AIDS epidemic and during a crucial moment in the AIDS epidemic, when there were still a lot of deaths. And also the Annals of Internal Medicine published I think this was the first comic published by the Annals of Internal Medicine in 2013, written by Michael Green and illustrated by Ray Rick, about the experience of this young intern, or basically the doctor remembering 20 years ago when they were a young intern and sort of making a medical mistake that potentially cost someone their life, and sort of living with that. So under the title Missed It, sort of the idea of guilt, physician's guilt, and living with that guilt. So a lot of these, the fact that there are visual pathographies, and then that there are also providers' narratives, right, written in comic format, has led many people to think about the potential, the comic's potential to build empathy, right? For us, for patients, for example, reading these stories written by doctors and other healthcare providers, and vice versa, for providers to understand the subjective experiences of illness for their patients, right, through reading their narratives and reading their comics, as a way to build empathy. There are also attempts to actually address this more directly. For example, in Patricia Anderson's a comic, Difficult Doctors, Difficult Patients, which was published in the Journal of the American College of Radiology, we see this, the comic goes, this is just an excerpt from the comic, right? These are all excerpts. We see, sort of like the panels going side by side. One of them is showing the doctor's side, what is happening to the doctor from the doctor's perspective, and the other side is showing the patient's perspective in the lead up to a liver biopsy, and then the aftermath of that, during the biopsy and the aftermath, et cetera, to sort of see what each person is thinking about and what they're concerned with, et cetera, as a way of building empathy and building bridges. Kathy Leaney, whom I had mentioned also before, has created this comic, What the Hell, Why is My Doctor So Late? In which, there is, again, this idea of the patient thinking about, okay, like I'm not getting what I need here. And then the sort of like explaining from the doctor's perspective why they sometimes need to spend more time with a patient, the demands on their time, how they are overworked in many ways, and how some of the hospitals or places where they're working are understaffed, et cetera, et cetera. So from here, I wanted to talk about the ways in which graphic medicine over the past 13 years or so since the term was coined, right? And since the first graphic medicine conference, annual graphic medicine conference, was held in 2010, right? The field has gained a lot of legitimacy, a lot of visibility. Obviously, the fact that the Annals of Internal Medicine, for example, now runs a section, a web exclusive section that is always made free or open access for all, called Annals Graphic Medicine. And the fact that Annals of Internal Medicine, which was published by the American College of Physicians, is one of the most influential and widely cited medical journals in the field, sort of shows, the growth of the field and the impact it is having on physicians and on medical authorities in general, who are seeing a value in that, in this format and in this genre. But also the fact that the NLM recognized this field as an important field to document and to build a collection to support the field of graphic medicine. In 2018, the National Library of Medicine launched their collection of graphic medicine. It included also an on-site exhibit, a traveling exhibit, and an online exhibit, and curricula, both for high school students and for college students. The exhibit, which was developed, curated by Ellen Forney, author of Marbles and Rocksteady, which are also by now classics in the graphic medicine canon, it was called ill-conceived and well-drawn, and continues to offer a lot of resources to people, scholars, practitioners, and students of the field of graphic medicine. So to put it crudely, one thing you might have noticed is that a lot of the narratives that I've talked about so far, obviously it's not an exclusive list, it's not an exhaustive list of everything that's been produced in graphic medicine. There's a lot more. But the field of graphic medicine has been predominantly white and middle class. And I'm putting it crudely here. Why is graphic medicine so white? There are, I think, a lot of reasons we can think about why this is the case. There's obviously the fact that there's a lot of time and effort needed in order to produce a graphic narrative. A lot of people think that graphic narratives, comic books, are easy to read. You can read a comic book in a couple of hours, or 2 to 3 hours, and be done with it. But I don't read graphic novels that quickly. Actually, I think that graphic novels and comic books are a format that actually invites us to delve deeper, to pause, to set the pace for our reading and our experiencing of the art involved. There is a lot to unpack when we're reading graphic narratives, but a lot of people think that it shouldn't take that much to produce a graphic narrative. It actually takes many hours to produce even one page with maybe 4 or 6 panels that you can consume in a minute, right? And this definitely is a huge obstacle for people who may be dealing with illnesses, who may already be disadvantaged as a result of being sick, or dealing with a significant health condition. And so, for example, when we think about a lot of the comic books or graphic novels, graphic memoirs that have been produced on breast cancer, which there are so many of them, I'm choosing only 4 here to illustrate, they were all produced by white women. And even though white women are slightly more likely to develop breast cancer than Black, Hispanic, and Asian women, Black women are actually more likely to develop more aggressive, more advanced stage breast cancer, and are also more likely to die from breast cancer. So why is it that we're mostly seeing white narratives about breast cancer, and white middle class, if you will, white middle class narratives? I think it's because there is, it's hard for me to think that it would be as easy for, a Black single mother who's working several jobs in order to make ends meet, for example, right? To find the time to reflect and to write and process and write about her experience with breast cancer, and then to find a publisher who would be willing to do that. 76% of the publishers and editors in this country are white. And there is obviously a tendency to privilege white middle class narratives and stories as a result. But additionally, I think that there is also the stigma of sharing. In his 1963 classic Stigma, Notes on the Management of Spoiled Identity, sociologist Irving Goffman explains how stigma functions as, quote, a means of formal social control, end quote. Stigma is socially produced, and for Black, Indigenous, and other people of color, the racial stigma combines with the stigma of illness to produce a condition in which BIPOC individuals are compelled to keep their woes private, or to only share them with kith and kin, when a lot of the ailments afflicting populations of color are constantly stigmatized as lifestyle diseases, for example, arising from misguided notions that these ailments are the result of life choices, diet, exercise, smoking, etc. Few people of color are likely to find a space that would allow them to share their experiences of illness without judgment, without fear of judgment. And then there is the notion of confessional narratives and who engages in confessional narratives. As Michel Foucault says, Western societies, in the history of sexuality, Western societies have established the confession as one of the main rituals we rely on for the production of truth. We have since become a singularly confessing society. Western man has become a confessional animal. And obviously, by Western here, there is a lot of conflation between Western and white in this context, right? Foucault was not known to necessarily take race into account in meaningful ways. So where confession is no longer tied to its Christian roots of guilt, but to new forms of modern subjectivity. The ideas, for example, related to coming out, the idea of coming out, whether it's coming out in the queer context or coming out in the disability context, etc. Coming out rituals become secular confessional practices and techniques that mark modern subjectivity and which are valued for their ability to produce truth. Foucault describes how confession basically permeates all fields of social life, justice, medicine, education, family relationships, and love relations, the most ordinary affairs of everyday life, he writes. And so confessional writing, when it comes to confessional writing, Foucault describes how techniques of the care of the self surpass the oral rituals of confessions to the written, as the self became something to write about, a theme or object/subject of writing activity. Foucault also writes that all the so-called literature of the self, private diaries, narratives of the self, and so on, cannot be understood unless it is put into the general framework of these practices of the self. People have been writing about themselves for 2,000 years, but not in the same way. In his book, The Art of Confession, The Performance of Self from Robert Lowell to Reality TV, and in a chapter cleverly titled The Unbearable Whiteness of Being Confessional, Christopher Grobe writes about how confession is, quote, privilege in its purest form, straight, white, cis male, blue blood Protestant privilege. And he says, who can work with confidence in a confessional mode? Who, once they have done so, will be received by the public as confessional? More than that, who will be celebrated for confessing? He also relies on Michael Nieto Garcia's autobiography in Black and Brown, in which he writes, not only do readers read a Black author's autobiography as racially representative, racial relations and the representational expectations imposed on Black subjects are also so much a part of personal experience that they become integral to one's story. This is probably very well exemplified in James Baldwin's work. Many have highlighted James Baldwin as an example of this Black literary tradition. Henry Louis Gates Jr., for example, describes how Black writing posits both the individual I of the Black author as well as the collective I of the race. And in this case, when we think about the I here, which is singular only by grammar, as Grobe says, is the I of witness and testimony. James Baldwin writes, I am a witness to whence I came, where I came, witness to what I've seen and the possibilities that I think I see. This is a different I from the singular I, right? Or when he writes, I picked the cotton and I carried to market and I built the railroads under someone else's whip for nothing. This all goes to explain why, in my view, taking the confessional aspect of graphic medicine for granted is problematic. It's something that we need to question, we need to investigate when we think about why confessional narratives are so white, why graphic medicine as a field in general is so white and so middle class. So enter the COVID-19 pandemic, right? Which has spurred an explosion of comics, both in print and on the web. Comics that portray aspects of what Saji, Vinkarsan, and Callender call in this article covidity, a term they coined to denote both individual and collective philosophical, material, and wide-ranging emotional responses to the COVID-19 pandemic. We see COVID comics for doing all sorts of things. Autobiographical comics about getting COVID or caring for loved ones with COVID and the different symptoms that one experiences. We find comics showing people's resistance and resilience and the ways in which they are coping collectively. This is, for example, from depicting what people were doing in Wuhan during lockdown, or showing what's happening inside spaces that are often unseen during the pandemic, like ERs or ICUs, and the way of depicting those clinical spaces and the toll that COVID has taken on healthcare workers and on patients and their families. These are all examples of that. Or the idea of families being away from loved ones while loved ones are receiving treatment, right? And how that impacts patients' treatments and their decisions around treatment. Or talk about topics that are that have taken a backseat in many ways during the height of the pandemic, at the beginning of the pandemic, like mental health, for example, and something for people with anxiety, for instance, or obsessive compulsive disorder, etc. Something as simple as going to the store, for example, and what that might entail. Or using humor to introduce levity to otherwise very distressing and disturbing situations, right? Whether it's the isolation or, having COVID, getting COVID, or being away from loved ones, etc. These are all comics that use humor and levity. Educational comics as well, have played an important role, and we've seen a rise in those during the pandemic, whether it's explaining how the virus mutates in simple terms and using simple graphics, or debunking some myths around like the safety of vaccinations during pregnancy, or even things like how to use a playground in a pandemic, right? Things as simple as that. Or what does it mean to wash your hands for 20 seconds? What does that actually look like, right? What do you do for 20 seconds? Or putting things in historical perspective and thinking about previous pandemics, for instance, and how they compare. So sort of putting statistics and historical ideas in context in relation to the current pandemic in a graphic or visual format. There are even a lot of comics for children. NPR published several comics during the COVID pandemic targeting children, explaining, for example, this one was explaining the COVID-19 or the SARS-CoV-2 virus, the coronavirus, right? What it is, like, oh, you must have heard of that at the very beginning of the pandemic. What is this? Or things like, what should we do? How do you process your feelings around this? You must be feeling worried, scared, frustrated. How to process that? The Graphic Medicine website has documented a lot of these COVID-19 comics, and a new phenomenon I'm arguing here is that COVID-19 comics present a much more significant diversity of creators and narratives that touch upon the lives and experiences of BIPOC individuals and communities and on other marginalized identities. Take, for instance, this comic that was produced, serialized online, and then collected in a collection called Corona Comics. This series is called Tribal Corona Comics, where Henry Payer, who is a Ho-Chunk artist and an enrolled member of the Winnebago tribe of Nebraska, in collaboration with Bob Hall, who is a famous artist and writer who has worked for Marvel, among other big comics publishers, write this comic that discusses questions related to epidemics and settler colonialism and the interactions of settler colonial and tribal medicine through the figure slash ghost, if you will, of physician and former reformer Susan LaFlèche and reformer, excuse me, Susan LaFlèche Picot, who is widely acknowledged as one of the first Indigenous people and the first Indigenous woman to earn a medical degree. Or this comic that was published by the NIB by Aragon Starr, who's an enrolled member of the Kickapoo tribe of Oklahoma, and Callie Benally, who's Navajo writer for Indian Country Today, about the impact of the COVID-19 pandemic on the Navajo Nation. This other comic published also by the NIB on, how to have a powwow in a pandemic, and how for Indigenous folks, the meanings of sociality, emerge out of oppression, actually, and the meanings of epidemic emerge out of settler colonialism. And so the changing valences of having a powwow during the pandemic. This comic published by the NIB as well by Nicolo Pizarro, who's a Filipino-American queer comic artist who lives in Queens, and created this comic about Elmhurst Hospital, which serves mostly BIPOC, migrant, and incarcerated folks during the pandemic, and how the lack of resources and underfunding contributed to dismal outcomes there. And so despite the praise that was heaped on then New York Governor Andrew Cuomo for his sort of like handling of the pandemic, comics like this shed light on the ways in which policies like his had left the city, and especially the most impoverished and marginalized segments of the city, unprepared. There's also the twin pandemic of COVID and white supremacy. A lot of comics talked by Black creators and creators of color talked about the summer of 2020, and talking about the systemic racism and the twin pandemic of COVID and white supremacy, and how in this comic, for example, which talks about Fran Tirado, one of the organizers of Black Trans Lives Matter in Brooklyn, he says, racism has killed more people than COVID-19. And so the work of an activist is that of an essential worker. And it was never a question of as to if we're going to go out and protest and organize, it was how, right? Or since I'm in Baltimore and based in Baltimore, the story of Tawanda Jones, whose brother Tyrone West was killed by Baltimore police in 2013, and sort of her organizing work, despite having all sorts of concerns about her health and the health of her family, who have underlying health conditions and are particularly vulnerable, to sort of go out and protest and organize also during the COVID-19 pandemic. Stories of essential workers, grocery store workers, for example, most of whom are people of color, who were dying at 2.5 times the rate of white Americans. And so the story, for example, of Lilani from Largo, Maryland, and her mother Zenobia, who, after Lilani died, who used to work at Giant, and said, she said that after her death, Giant Foods mailed the family her final paycheck, and it was for $20.64. Also, issues related to racism, particularly anti-Asian racism, anti-Asian hate, that we've seen during the pandemic, has been a crucial topic in many of the comics produced by Asian creators. So, for example, this one that talks about being on public transit while Asian, or this comic by Victoria Ying, where she talks about comfort food and how she's been resorting to comfort food during the pandemic, but not just out of comfort, but really also because she no longer feels, or at least during the time when she was writing that in the summer of 2020, didn't feel comfortable going to her local grocery store. She only felt comfortable in Asian supermarkets because of the anti-Chinese racism and the hatred towards a lot of Asian people. And so she says, for now, I'll find comfort in the food of my people. even questioning things like the meaning of having a bubble or having, the white centric notion of a family as a nuclear family, a small nuclear family that you live with and you're not seeing anybody else, etc., has been questioned by some creators of color. Like, for example, this comic by Victoria Marcelino, where she's talking to her grandma, who is expecting her to visit and to be with her, and trying to explain to her how she's not going to be able to visit because her grandma is high risk, etc., but how that tugs at people in communities of color in ways that are different from the way they were for white families. Whit Taylor, a Black comic artist, wrote a very short comic, but I think very poignant one, about giving birth at the height of the pandemic and being completely isolated, not having anyone, not even her partner, etc., be allowed to be there. And also the idea that the first time for her baby to see her face was while she was masked, and sort of like how that was very sad, and even things like people of color being across borders, right? So thinking internationally as well, thinking about people of the global majority. Here, for example, Max Law writes about being separated from his significant other, his working in Malaysia while his significant other is in Singapore, and how the fact that this one bridge that connects the country was closed, meant that they couldn't see each other for months and months, even though they were only separated by a few miles, right? Or, for example, from Brazil, Laura Ataide, who writes about Bolsonaro and how his mishandling of the pandemic. There are so many ways in which we see authors and artists of color sort of contributing to comics production in ways that I argue are unprecedented for the field of graphic medicine. These are just some of the covers of some of the works that I have used here. There are so many more. And I want to leave you with just a couple of thoughts here. One thought is around why. Why do we think that this has changed? The sort of like, why are we seeing more creators of color in the field of graphic medicine? One, I think, is the public nature of COVID-19, that the emphasis here has been displaced from the confessional, which I discussed already, to something else, right? Where the I here, even when people are writing from the I, they are writing from a different I, an I that combines the individual and the collective in ways that were sort of like unprecedented in the field of graphic medicine. And the other element, I think, is the so-called twin pandemics, right, of COVID-19 and systemic racism, or at least the reckoning with that pandemic of white supremacy and systemic racism, which prompted a lot of people to find ways in which writing about the COVID-19 pandemic can be an invitation also to write about racism, to write about how communities of color were disproportionately impacted by the pandemic, and to write about the different ways in which racism and racial inequalities were exacerbated by the pandemic. And then finally, I want to say, I want to leave you with a couple of observations. One is that a lot of these comics were comics that were published online. They're web comics, or they were part of edited anthologies, or both. But none of them are really single authored, monographs that were published in print, etc. And I mentioned before the fact that 76% of publishers and editors are white. It is one of the whitest industries or sectors, if you will, there is. And that's definitely a huge obstacle, right? Something to think about, that, publishing online has been easy, or has been more accessible to a lot of people. But the other ways in which people can actually become part of the canon is really through publishing those book-length graphic narratives, which has not been possible so far for a lot of BIPOC creators. Another thing is that we're seeing a more expansive views of graphic medicine, of medicine and of graphic medicine, that pushes the field to thinking beyond the clinical, right? It is embodying a certain view of social medicine that understands health and illness and healthcare discourses within a wider political and social context. And then there are different subjectivities. We see that, I mentioned that the collective I is dominant here. Even when one is sharing a personal experience, it is often an experience that is representative of a wider community or a wider concern shared by many. And then to conclude, I want to call upon the ethos of graphic medicine from the Graphic Medicine Manifesto that I think will help us push this forward so that these influences are not a transient phenomenon that we're seeing just as a result of the COVID-19 pandemic, but will hopefully have a lasting impact on the field. In Graphic Medicine Manifesto, the editors write, graphic medicine is also a movement for change that challenges the dominant methods of scholarship in healthcare, offering a more inclusive perspective of medicine, illness, disability, caregiving, and being cared for. Thank you very much for taking the time, and I welcome your questions.
Dr. Bayoumi, thank you very much for a fascinating talk. We have time for a few questions, although we've received many. I've taken the liberty of combining a few of them. Let me just say that several people have written in. Thank you very much for this very interesting talk. Is there an online repository for graphic medicine?
Yes,
that you might recommend?
graphicmedicine.org. Go there right now. Run, don't walk. It's great. And they are, as I mentioned before, they are compiling a lot. Obviously, it is not exhaustive, but they're compiling a lot of works that come out. There's also the Graphic Medicine podcast, which you can also find links to on the website. And they're, I mentioned they're compiling a lot of the graphic medicine comics produced during COVID under COVID-19 comics rubric.
Thank you. Another individual writes in, thank you for your fascinating talk on an understudied topic. You noted that the impact of graphic medicine is the ability to convey concepts through a combination of texts and images. When we want to translate these works into other languages, how do we ensure that the image component translates as well as the text? Are there examples of graphic medicine books being successfully translated and well received in multiple languages and multiple cultures?
Yes, that's a great question. Translation is always tricky, right? And obviously adding another element, which is the element of the visual, right, adds another layer. In some ways, it can facilitate the translation, right? In some ways, the visuals can be an aid to understanding what's going on, particularly when the visuals are universal or are easily understandable, easily translatable in many contexts. But in other ways, it can add a layer of confusion, right? If they are not readily translatable, if they're not readily, legible in other cultures or in different contexts. So there have been a lot of graphic novels that have been translated both from English and to English. For example, one of the most important books in the graphic medicine canon is Epileptic by David Bouchard, David B., who's a French author, creator, comic artist. And then there are many graphic novels written in English that were translated into other languages, such as, for example, The Story of My Tits by Jennifer Hayden, which was recently translated into English and will be translated into other languages as well. Marbles by Ellen Forney, etc. There are a lot of graphic novels that are being translated. There is also the Spanish Medicina Gráfica, which is sort of like the sister website to graphic medicine, which highlights works produced in Spanish, some of which have also been translated into English, but is also producing original work for the Spanish-speaking world. Yeah, I hope this answers the question.
Thank you. Yes. So I want to reserve the few minutes we have left with two questions, one about the past and one about the future. Several people have written in observing that educational and didactic comics about medical conditions written by medical providers or written by patients go back to at least the 1950s and were really common by the 1960s. So the first question is, can you say more about the ways in which the current field, formal field of graphic medicine differentiates itself or acknowledges these didactic comics from the 1950s, 60s, and really the 70s? And then where do you see the field of graphic medicine going in the next, say, decade to 2 decades?
Great questions. In terms of the past, I think there are particularly librarians and there are a whole lot of librarians in the field of graphic medicine who are very active in the field of graphic medicine, are the ones who are particularly keen on documenting the history of the field, even avant la lettre, before it was called graphic medicine, right? The different ways in which, visual narratives and pictorial depictions were sort of used to communicate certain ideas or to, educate the public, et cetera, in the field of medicine. And so I think particularly librarians and archivists are really interested in that, in sort of like uncovering the longer history of the field and sort of trying to make sense of the ways in which the field has changed and or not, right, over the decades. As for the future of the field, as someone who's like in the field of history, I'm always loath to comment on future. We don't make for great prognosticators or predictors, but I hope that the field will gain even more popularity, will gain even more legitimacy, if you will, even though I don't really like that term, but the idea of being taken seriously. I remember it's been like maybe 7-8 years ago now that I've first offered the idea of teaching a course at the time in the Department of History of Science on that would include primarily talking about graphic medicine, and being met with like people scratching their heads as to like, what is this? Are you going to be teaching comics? And I'm like, yeah. And people being kind of skeptical about that at the beginning until like I started to show them, oh, there's like actually this website, there's this annual conference, we do this. There are people who write in a scholarly way about this. There are, and then now I think it's like a lot of people are accepting this much more readily as an important way of thinking about the world, and even in a scholarly way, and even thinking about comics. And my colleague, co-author Shireen just very recently published an article in Medical Anthropology Quarterly about using the multimodality of citation and the politics of citation using comics, right? And so it's sort of like thinking about comics even as a scholarly source, as an important way for people to archive their lives also in many ways, right? When we think about diversifying the COVID archive, I think this is one of the ways in which we can think about people, people depicting their lives in visual ways and in these using graphic narratives, right, as an important way for everybody, whether they are in the field of graphic medicine or outside of the field, to take these productions seriously. I also think, or at least that's my hope, I hope it's not wishful thinking, that the moment that we're witnessing, and this is the point I was trying to end with, the moment that we're witnessing has really had a huge impact on the field, on what we're seeing and on what counts as graphic medicine, right? And in ways that are more inclusive of diverse voices, diverse ways of representing the world that are not necessarily aligned with the classical ways, which in my view are, reflective of white middle-class morality, right? But are expansive and pushing the field forward. So I hope that the field will be, will embrace these different voices and sort of diversify the canon, if you will.
Thank you, Dr. Bayoumi. And I most certainly think and believe that your talk this afternoon will encourage many who are watching to embrace the field of graphic medicine, if not visit the websites that you've mentioned, pick up some of the material and study it and continue to learn more about it, be fascinated by it, and continue to engage it in all of the complexity and opportunity that you describe. Thank you very much. And I'll also say thank you very much for mentioning NLM's traveling exhibition on graphic medicine. I'll just add very quickly that the origin of that project began with a conversation. My former colleague, Patricia Tui, came to me to talk about graphic medicine, and I sat there scratching my head. And here we are, testimony to Patty Tui's leadership and vision in cooperation with Ellen Fournier, of course. And we now are engaged in that collecting robustly, reflecting culture, society, and medicine and all of its complexity and opportunity and the challenges that we face in those areas. So I want to thank you very much for your presentation today. Thank you for preparing it, for engaging with us. We wish you all the best and look forward to keeping in touch. Thank you very much.
Thank you very much, Jeff. I appreciate you. I appreciate the opportunity. Take care.
Thank you. Have a good afternoon. Thank you all for watching. Bye-bye. I'll just mention that our next talk is going to be by Dr. Wayne Soon on May 11th. Please join us to tune in and watch Dr. Soon's talk on global medicine in Taiwan. And we look forward to welcoming him, and we thank Dr. Bayoumi again for her great presentation this afternoon. Thank you all for watching, and please tune in the future for our future history talks. Bye-bye.